are we gonna learn today? It's beings, brainy tigers.
In today's video, we will be looking at epilepsy and the paradox that comes with it. An epilepsy, which consists of multiple seizures, occurs when there is an uncontrolled electrical disruption in the brain that would normally be balanced between inhibition and excitation. Inhibition and excitation are kind of the yin and yang of the brain. Excitatory signaling is concerned with how likely a cell is to fire, while inhibitory focuses more of how a cell is less likely to fire. Excitatory and inhibitory has a lot to do with action potential, which can be defined as a sudden rise and a succeeding fall with membrane potential or voltage that is seen across a cell's membrane. The image seen displays the steps of an action potential. The rise of the graph at number 2 is known as depolarization, meaning that it sees pro-excitability. This is where sodium ions go into the cell. And the fall of the graph at number 3 is known as repolarization, where we are observing anti-excitability. This is where potassium ion goes out of the cell. Let's look at the image below. The brainwaves that are colored red displays the rapid disruption that can be seen when someone is going through an epileptic seizure. When looking at epilepsy, it is important to note that the majority of cases deal with having a mutation in V-gated sodium and calcium channels that make them more permeable and therefore more excitable. This leads to hyperexcitability and excessive action potentials that result in seizures. So yes, there are a lot of epilepsy cases where an observed increase of sodium is found, but recent clinical research has actually found something even more interesting. It has been seen that there are people with a reduced function of sodium channels that develop late-onset drug-resistant seizures. Brainy viewers, this is an exciting paradox. How can the function of this channel that is usually connected to the silencing of neurons be able to cause epilepsy?
A possible reason for this could be due to the circuit-level ratio of excitatory and inhibitory neurons, or E&I neurons for short. Usually what happens when a seizure occurs is there's an increase of E neurons leading to an increase in sodium channel activity and therefore excitatory synaptic activity. But if this mutant sodium channel is present in I neurons, it will decrease sodium channel activity and therefore reduce the possibility for I neurons to release GABA. This effectively enhances circuit excitability by disinhibiting E neurons. What about the reduction in sodium channel activity occurring in E neurons? How would it then enhance excitability? Take a moment to think about this. This is a very puzzling case, and scientists don't totally understand this paradox themselves. Based on basic neurophysiology, reducing sodium channel activity is expected to silence E neurons, a condition that is not favorable for seizure production. Research has revealed that these observed seizures may have to do with potassium channels compensating for the sodium channel deficiency. This is known as the compensatory downregulation hypothesis, which is believed to result in a reduction of potassium channel expression. This decreased expression overcompensates by resulting in too few potassium channels for the few sodium channels present, which allows for hyperexcitability. Sodium current dominates the potassium current, allowing for excessive depolarizations, which leads to seizures. Well, what have we learned today? We have certainly explored several interesting hypotheses about sodium channels that may result in epileptic seizures. What is more important, though, is that we have learned where future studies can be done on these findings in an effort to produce therapeutic drugs to relieve patients of these seizures. These studies can be used to target specific channels for therapeutic drug intervention. Scientists can begin to look into drugs that can open more or express more potassium channels in patients that face the overcompensatory mechanism. In patients that experience disinhibition of GABA release, scientists can begin experimenting with drugs that reduce the expression of potassium channels, or more simply block these channels to a certain extent in inhibitory neurons. One last question for the viewers. Can you think of any other possibilities that explain this paradox? Or any potential ways to inhibit these channels that may cause seizures? If so, we will leave you with our references to the studies we reviewed, and you can continue on with the research.
We have learned so much today, thanks to